How do you use the information you collect? Are you interested in just telling your patients about their eyes, or are you interested in also helping them prevent strokes and heart attacks because you can?
Digital retinal imaging is all about communicating, diagnosing, and preventing eye and systemic disease. As you view the images in front of you, you receive communication. You immediately see in the upper picture that the person has hardened the arteries that is threatening their health. In the second picture below, you see a more severe case. You can not only judge what the disease is, but you can determine the risk of imminent stroke or heart attack. Years ago, we had the DOS era before Windows, and what you're looking at on the screen is your typical DOS screen. If you were to fill it with information, it might look like this. Not very exciting. If you read the text, it would tell you something, but this was not a great way to start communicating. But this is what we had. As we moved from the DOS era to the Windows era, something dramatic happened. Within seconds of looking at a Windows image, you could see and get an impression that told you much more than even the text could do. There was graphics, there was formatting, there was color. And looking at the picture in seconds told you something important that you needed to know, and the text filled in the details. The DOS image told you nothing until you, through imagination and dedication, gathered the data. Both of the images you are seeing, the one you saw before that was in DOS, and the one you're seeing now in Windows, has basically the same information. But look at the difference in communication. You have information in your office. You are collecting information that's valuable to your patients. How you communicate that information makes all the difference. Whether it's used, whether it's not. Whether the patient gains something from it as they come to see you or not. Whether your practice is making a profit or not. You have tons of information that you are not communicating to your patient. And when you do, you will profit and your patient will profit from your superior care. And that is what we're here to show you next. DRI, or digital retinal imaging, allows you to take the information you already have in your office and provide your patients a much better analysis of their health and a much better communication of what their health care needs are as regards their eye health and their systemic health in just minutes. In just a few minutes, we're going to show you how that works. Keeping in mind the difference between the Windows and DOS presentation of information, let's look at the UReview program that comes with Optos and see the difference between an Optos retinal analysis and a digital retinal analysis provided with DRI. We are now viewing a digital retinal image that allows you to visualize the optic nerve with glaucoma in great detail, and in fact, as you can see, measure all the characteristics of the nerve and view those characteristics as predictive of the level of glaucoma and change in glaucoma. This is a very highly detailed, sharp, crystal clear view. Windows versus DOS. Now we're going to look at the UReview image that Optos offers of a glaucomatous nerve of significantly more deterioration, and yet you'll notice that you can hardly assess anything. This is not an image you would want to work with if you're diagnosing and monitoring glaucoma, because comparison would be most difficult. The difference between DOS and Windows. Now in our next view, you're going to look at digital retinal imaging as it depicts macular degeneration. This is early degeneration. You can see a lot of the characteristics that will help you compare from patient to patient. It's clear that there are details that are in the macula and that are peripheral, and the quantity and quality of those details. Now let's look at the Optos image. Tell me something. Can you really believe that you're going to be able to analyze this image and make any sense? In fact, I can't even tell this person has early macular degeneration, and yet if you look on the Optos site at their UReview photos that we've imaged this in, you will notice that this is a sample image that they're representing. I find that another example that reminds you of DOS and Windows. Now this is a diabetic retinopathy, clearly seen with digital retinal imaging. You notice the dot hemorrhages, the exudates, the blot hemorrhages. It's clear and detailed and communicates a lot, and you can compare this from image to image. Next, we're going to look at the U-Review sample that Optos uses as a representation of diabetic retinopathy. Pretty much the same level. Not too much information, is there? Yep, that's the difference between digital retinal imaging and Optos. Now, I'm going to tell you that this is a specialized use that you can put your DRI software to.
See our next video to learn how DRI software can be used in your routine yearly eye exams and how it will help your practice grow logarithmically.